The lobotomy was not invented by a fringe figure working outside mainstream medicine. It was developed by Antonio Egas Moniz, a Portuguese neurologist who won the Nobel Prize in Physiology or Medicine in 1949 specifically for this work. That fact is important to sit with. The procedure involved severing connections in the prefrontal cortex, the part of the brain most associated with personality decision-making and complex thought. Early versions involved drilling holes in the skull and inserting instruments to cut or destroy brain tissue. Walter Freeman, an American neurologist, popularized a faster version called the transorbital lobotomy, in which a thin pick was inserted through the eye socket above the eyeball and into the brain with a mallet. Freeman could perform the procedure in minutes without a surgical theater. He traveled across the United States in a vehicle he called the lobotomobile, performing the procedure in psychiatric hospitals and offices across the country. He operated on patients of all ages, including children. He performed a lobotomy on a 12-year-old boy. He performed one on Rosemary Kennedy, sister of John F. Kennedy, at the request of her father. She was left permanently incapacitated and spent the rest of her life in institutional care. Her family did not speak publicly about what had happened to her for decades. The procedure was embraced by psychiatric institutions and state governments, largely because it produced compliance. Patients who had been agitated, violent, or difficult to manage became passive and manageable after the operation. Whether that constituted improvement was rarely interrogated. Patients could not advocate for themselves afterward. Families were often told the person was doing better. Some 4,000 to 5,000 lobotomies were performed in the United States. The procedure fell out of favor not because it was banned or because medicine had a reckoning with what it had done, but because antipsychotic medications became available in the 1950s and offered an easier way to achieve the same behavioral control. The lobotomy was not rejected. It was replaced